Hi, I'm Dr. Chernov, and in this video you'll learn about 5 possible causes of groin pain that can be relieved with simple exercises at home. In the second part of the video, I've prepared a set of exercises to help quickly relieve groin discomfort. Thanks for liking and subscribing, and enjoy! So, the first common cause of groin pain is problems with the hip adductor muscles. This muscle group includes the Pectineus, Adductor longus, brevis, Magnus, and Gracilis muscle. A tight spot or trigger point in the Pectineus muscle causes a nagging pain in the groin just below the inguinal crease, which intensifies when the hip is abducted. Pain from this trigger point can also radiate to the anteromedial aspect of the thigh. Trigger points in the adductor longus and brevis muscles cause pain within the groin and slightly above, as well as along the anteromedial thigh. The pain intensifies with exertion and with sharp hip rotations. Trigger points in the adductor magnus, located in the middle of the muscle, refer pain upward into the groin and down the anteromedial thigh. Trigger points located higher up cause widespread pelvic pain, sometimes radiating to the pubic bone, vagina, rectum, and bladder. A problematic gracilis muscle causes a sharp, burning pain that extends along the inner thigh. The pain persists both during muscle activity and at rest. Walking may provide some relief. To relieve pain and trigger points in the hip adductor muscles at home, massage the inner thigh, for example, with a foam roller, and then stretch the muscles by performing one of the hip abduction exercises. A second cause of groin pain is a problematic iliopsoas muscle, or more specifically, the psoas major muscle within it. A trigger point located in the psoas major muscle refers pain to the back, as well as the groin and anterior thigh. When the iliopsoas muscle is damaged, pain intensifies in an upright position and is almost imperceptible when lying on the back. Difficulty rising from a deep chair and the inability to sit up from a lying position may be noted. In the most severe cases, mobility can be so limited that the person can only move on all fours. To relieve tension and stretch the psoas major, extend your leg at the hip. A third cause of groin pain can be the quadriceps, which consists of the rectus femoris, vastus medialis, vastus lateralis, and vastus intermedius. Trigger points in the vastus intermedius, which lies beneath the rectus femoris, cause pain along the anterolateral thigh to the knee, with the greatest intensity in the mid-thigh. Sometimes trigger points in the upper rectus femoris and vastus intermedius can cause a hip buckling sensation, which occurs when simultaneously extending the knee and hip joints of the leg-bearing body weight. Also, damage to the vastus intermedius can cause difficulty fully straightening the knee, especially if the leg has been immobile for a long time while sitting. You can massage the quadriceps with a foam roller and stretch them with hip extension and knee flexion exercises. The fourth cause of groin pain is the oblique abdominal muscles. Trigger points located in the lower lateral abdomen refer pain not only to the groin but also to the lower abdomen. Exercises that include twisting the torso can help relieve tension in obliques and eliminate discomfort. Finally, the fifth muscle cause of groin pain is the Quadratus Lumborum. The trigger point, located just below the 12th rib, causes pain along the iliac crest, which sometimes radiates further into the lower abdomen and groin. With problems with the Quadratus Lumborum, the pain is most often dull, but with movement it can transform into a sharp or even stabbing ache. An awkward movement, such as making a bed, can cause pain so intense that the person literally falls to their knees and can only move on all fours. Now that we know the 5 main muscle-related causes of groin pain, let's try a set of exercises to relieve the discomfort at home. To effectively relieve pain caused by trigger points and increase muscle tension, you should first massage the muscles and then stretch them. If you don't have a foam roller or a 2-liter bottle of water handy, skip to the second part of the exercise routine, where we'll do some stretching. If you have a large foam roller or a 2-liter bottle filled with warm water, lie on the floor, face down, and bend your right leg at a 90-degree angle at the hip. Place the foam roller under your inner thigh, parallel to your spine. Supporting yourself with your hands and left leg, massage the muscles of your right leg from the groin to the knee for 1 minute. In this position, we'll work all 5 adductor muscles of the hip. Take your time, move slowly. If you notice an area of increased tension or soreness, hold there for 30 seconds, then massage the muscles again. If there are no painful areas, simply massage the inner thigh for 1 minute. Then return to the starting position. Place the foam roller or bottle under the front of your right thigh, perpendicular to your leg, and massage back and forth across the quadriceps for 1 minute. Rotate your legs slightly to the right and left to work the muscles from different angles. You can perform this exercise with your right knee bent. You can also increase the intensity of the massage by placing your left leg on top of your right. If you notice a sore spot in the muscle, hold there for 30 seconds. Return to a neutral position and bend your left leg 90 degrees at the hip. Place the foam roller under the inner thigh. Slowly massage the adductor area for 1 minute, maintaining smooth and deep breathing through your nose. If you find a sore spot, do not block your breathing. Try to breathe slowly and deeply, releasing tension from your body, and strive to relax the muscle. If you are struggling with the massage and have a loved one nearby, ask them to apply pressure from above while you perform this exercise. This will ensure that your adductor muscles are tested for trigger points. Return to the starting position and place the foam roller under the front of your left thigh. Perform the quadriceps exercise as you did for your right leg. Move back and forth for 1 minute, periodically changing the angle of the muscle. If you don't have any trigger points, simply massage the front of your thighs. If you do, hold them for 30 seconds, maintaining smooth and deep breathing. Return to the starting position and perform a short stretching routine for the 5 target muscle groups, which we covered in detail in the first part of the video. Sit on the floor with your legs straight in front of you. Slowly and gently move them as far apart as possible. Keep your feet perpendicular to the floor. Place your hands in front of you. Keep your back straight. With a natural exhalation, try to lean your torso slightly forward, feeling a stretch in the muscles of your inner thighs, and hold this position for 1 minute. Don't force the movement. Work gently, reaching a level of tolerable discomfort without going too deep into pain. Breathe smoothly and slowly through your nose, aiming to relax the adductor muscles of the thigh with each exhalation. Slowly return your torso and legs to the starting position. Bend your right knee and place your right foot behind your left knee. Grasp your bent leg with your hands and straighten your back. Holding your right leg with your left hand, twist your torso to the right and place your right hand behind you looking back. Breathe smoothly through your nose and hold this position for 1 minute. This exercise stretches the obliques and Quadratus Lumborum while slightly contracting the adductors, which we stretched in the previous exercise. Smoothly return to the starting position and straighten your right leg. Bend your left leg and place your left foot behind your right knee. Grabs your left leg with your hands and straightens your back. Hold the bent leg with your right hand and twist your torso to the left. Place your left hand behind your back, looking back. Hold this position for a minute. This exercise also helps stretch the lateral pelvic muscles, improving the function of the stomach, intestines, and all other abdominal organs. Slowly return to the starting position, cross your legs in front of you, and come into a kneeling position. Support yourself with your hands, step forward with your right foot, and rest your left foot on your knee and toe. Place your feet hip-width apart. This is the simplest version of this exercise for stretching the Iliopsoas and Quadriceps. To intensify the stretch, try straightening your left leg at the knee. Hold the final position for 1 minute, and for an even more intense stretch, place your hands on your right thigh. Feel the stretch deep in your abdomen and on the front of your left thigh. Breathe smoothly and deeply through your nose. If your muscles are struggling with the static load, make the exercise easier and place your left knee on the floor. Slowly return to the starting position. Switch the position of your legs. Now your left leg is in front and your right leg is behind. Repeat the previous exercise completely and hold the final position for 1 minute. Breathe smoothly and deeply through your nose. This simple exercise helps stretch your hip flexors, which become strained every time you spend long periods of time sitting at a computer or driving a car. It's also a great balance trainer and strengthens your glutes. Place your hands on the floor and step your right foot forward. Remain bent over, keeping your knees slightly bent and hip width apart. Place your hands on your knees, push your lower back forward, and achieve an even more intense spinal extension. Then press your ribs toward your hips, lean your torso forward, relax your back, neck, and arms, and slightly straighten your knees, keeping your lower ribs connected to your hips. Breathe smoothly and deeply. Hold this position for 1 minute. Check your neck again. It should be completely relaxed. This exercise helps to stretch the back muscles, including the Quadratus Lumborum. As you practice this exercise regularly, strive to straighten your legs more. When your legs are fully straight without losing contact between your ribs and the front of your thighs, try grabbing your shins with your hands. Bend your knees and slowly lift your torso upward, smoothly extending your lumbar, thoracic, and cervical spine. Inhale and exhale calmly. Place your feet even wider apart, keeping your feet parallel to each other. Inhale slowly through your nose and raise your right arm up. Exhale, bend to the left. Hold the final position for 1 minute. Stretch your right arm intensely and feel the stretch in the muscles of the right side of your torso, including the Quadratus Lumborum. Keep your pelvis in a neutral position. Do not tilt it forward or backward. Inhale and slowly return to the starting position. Exhale, lower your right arm. With another inhalation, lift your left arm, and as you exhale, bend your torso to the right, stretching the muscles on the left side of your body. Hold this position for 1 minute. Breathe smoothly and deeply through your nose. Keep your pelvis in a neutral position and reach your left arm to the right. With another inhalation, slowly return to the starting position. Exhale, lower your left arm down. Take a few cycles of calm breathing and finish the workout. If you have groin pain, you can do this exercise routine every day. I highly recommend checking out my extensive guide on working the hip adductors, which are a huge contributor to groin pain. Stay healthy and see you in the next videos.